Affects 1 in 20 women worldwide, though possibly as many as 1 in 9 here in France. More in Western countries than across Africa or Asia. Every minute, 4 women are diagnosed with breast cancer and 1 woman dies. Statistics that the latest report from the International Agency for Research on Cancer, part of the WHO, says are in fact worsening. To get a better insight, we can speak now to cancer epidemiologists specialised on the impact of the environment and our lifestyles have on it all. Dr. Valerie McCormack, thanks so much for your time. Can I start simply by asking you to break this down for us? That latest report says that breast cancer cases and deaths are projected to rise. Why would this be?
Thank you very much for having me, and good morning to you. First of all, I'd like to thank France 24 for highlighting Pink October for breast cancer awareness. This will help all females listening to the programme, not just now, but for generations to come. So breast cancer is a very common cancer worldwide, and although rates are very high in Western countries, including in France, even in countries where rates are much lower, in lower income countries, it's still amongst the top 3 cancers in the cancer profile of women in all countries. So there's no country in the world that can afford not to have a breast cancer control plan. And this is why the WHO, the World Health Organization, in 2021 launched a global breast cancer initiative. It's the 3rd cancer initiative, and the other 2 are on childhood and cervical cancer. So breast cancer is unfortunately very common, and unlike cervical cancer, where we have a vaccination that we can try to eliminate the disease in the coming decades, for breast, we don't have such a solution. The biology of breast cancer is such that it's a hormonal cancer. It's highly influenced by our reproductive lives, and the fact that these days, especially in Western countries, women are having less kids, they're having kids later, and their age at first menstruation has declined. The reproductive factors, of course, they have many benefits for women, and their women's empowerment and their own lives. But unfortunately for the breast, it does increase the breast cancer risk. What can we do? There are factors that are amenable to change, some lifestyle factors and other related to reproduction. So one thing that, although women are having less kids, enabling women to breastfeed for longer for each kid that they do have is very important. It's good for the woman, it lowers her breast cancer risk, and it's good for the baby as well.
Yeah, because
the other things are lifestyle.
Sorry, I was going to ask you, because looking at this latest report, one thing that I wasn't aware of was that division globally. I guess that's mostly linked to, as you were saying, the fact that we have less children, but also to lifestyle, less activity a lot in Western lifestyles. Is that the case?
Yes, there are several lifestyle factors. Reduction of physical activity increases breast cancer risk, alcohol intake, which is an issue in many Western countries, and obesity at postmenopausal ages. These are all increasing breast cancer risks. Just to say that in France, yes, it's about 11% of women who will be diagnosed with breast cancer before age 75, but this is as high as in many neighboring countries. So in all of Belgium, Norway, Denmark, Australia, the Netherlands, the risk of breast cancer before age 75 is between about 10 and 11%. So it's not a French issue. It's a Western European issue, and the increases globally will because globally women are having less kids and having kids later.
That's the main cause. Is the birth factor, not something in the air, in pollution, and what we're breathing, or indeed what we're eating?
There will be influences of the environment, certainly, especially endocrine disruptors and factors that influence hormonal levels, certainly, and we see that in obesity. But the major drivers are the fertility, our fertility issues. They're the major drivers of international differences. So we can somehow curtail high rates of breast cancer, but only to a certain degree. The major drivers are reproductive issues. And we've known this for hundreds of years, actually. It was in the 1600s where it was observed that nuns had very high breast cancer rates.
Very interesting. Before we leave you, just Dr. McCormack, before we leave you, can I just say, I mean, we're seeing the very high rates. I was surprised to think that they might actually increase the cases of breast cancer. But before we leave you, can we talk about how treatable breast cancer is? You know, that, you know, we might have a lot of occurrence, but we can treat it successfully in most cases, if I understand correctly.
Absolutely. So breast cancer rates, survival rates are very high, and they're particularly high in Western countries. We need to get those high survival rates. We need to bring those benefits to the rest of the world, and that's why WHO launched the Breast Cancer Initiative. So how do we achieve high survival rates? We need to diagnose breast cancer early, so women need to be breast aware, be aware of changes in the breast, so they present early to their gynecologist or GP to have any checks looked at further, and then access to quality care rapidly. And yes, it's a very treatable cancer, so we're doing well on that side.
Good note to end on. Dr. Valerie McCormack, thanks for your time and speaking to us here on France 24. Much appreciated.